Welcome to episode 22 of the Princeton Podcast with Mayor Mark Freda. In this episode, Mark was joined by Marion Reinson, the Executive Director of Eating for Your Health, a nonprofit organization here in Princeton that takes nutrition out of the clinic and into the kitchen by educating participants about how to source and prepare delicious whole food meals without processed ingredients. The Eating for Your Health staff works with a variety of community partners, including Princeton-area schools, adult communities, faith-based and civic-based organizations, businesses, and other local nonprofits to deliver programs about healthy food and nutrition in an easy-to-consume and non-judgmental manner. So without any further introduction, let's join our host, Mark Freda, and his guest, Marion Reinson, for episode 22 of the Princeton Podcast.
Marion, thanks for joining us.
Thank you for having me.
It's our pleasure to have you here. So, Marion, what is Eating for Your Health by Supper's mission?
Our goal is to help people learn about the importance of eating whole food for their health, the relationship between what you put in your body and how it fuels your body and your brain. And we do this in a non-judgmental way. We provide information about the foods that you're eating and then leave it up to you to decide what works for you.
Pretty simple. So, how and when was Eating for Your Health created?
So I believe it was 2005 that Dorothy Mullen started a group called Suppers for Sobriety, which was to help people on their journey to recovery by focusing on not just on removing those substances from their lives, but introducing healthy food as well. And then that morphed into suppers, and then recently we morphed to eating or rebranded to Eating for Your Health, because that really explains what we do. And so she started cooking in her home, having people cooking in their homes, learning about understanding how you feel as data, meaning if you've eaten something and you don't really think about food for a while, that's a good thing. If you've eaten something and you're not feeling well, that's something you need to be paying attention to. So really very straightforward and rather simple in the concept, and looking at just the way different foods impact the way you feel. So she started doing programs in, like I said, in her home and other people's homes, and then doing presentations. And we've taken it to the next level of really bringing in solid evidence-based information about nutrition and your health.
Which is great. And I'm sure Dorothy would be very proud of where the whole program has evolved to now.
I think about her all the time, like this weekend when I was with my college friends and we made sauerkraut. And then we were like, thank you, Dorothy. Wild and crazy we are.
So I believe you have a number of different programs. Can you briefly outline what some of those are?
Sure. So we start out with really basics of what's in your grocery cart, how to shop in a healthy way at the grocery store, really looking at what's in the foods that you're buying. So we just, take a little tour around the store. We have the building blocks of nutrition, which are your macronutrients, your proteins, fats, and carbs and sugars. Really breaking that down, because a lot of those, especially fats and carbs, people there's a lot of myths around the importance of those and how they impact your health. So we really just teach people how you and why you need those to include whole foods like that in your diet. We have a salad creations, which is really an artistic approach to making a beautiful salad or like crudité dish. So, looking at the lighter side of things. We are right now, our chief medical advisor, Dr. Addie Benito, who's an endocrinologist, is working on a couple of programs for us. One is what to eat after a cancer diagnosis. The other is what to eat if you want to lose weight. So many times you go to these programs and you hear about don't eat this, don't eat that, don't eat this. But then what do you eat? That's what we focus on. We focus on these are the foods you want to eat and why. So we have those healthy snacking. Everybody's looking for something that they can snack. They're like, I can't eat that many nuts. What else am I supposed to eat? We're working on that. So there's, the tools you need to prepare healthy foods. I can go on and on forever. The impact of that sugar has on your brain, your bone health, like what you need to be eating to maintain healthy bones. An herbal workshop that we do with Tish Streeton is kind of our in-house herbalist, and she's amazing. And when you listen to her programs, you feel like you're watching the BBC. But she's just really makes it easy to understand. That's our goal, is to make this easy to understand. And if people walk away with a few different ideas and tips about understanding how to eat, then that's how to eat in a healthier way. That's what we're looking for.
Right. Well, they certainly have a lot of choices there for people to figure out what it is that
we do
that meets their needs. So, do I need to live locally to take part in your programs?
That was one of the silver linings that came from the pandemic, was that we pivoted to everything was being delivered in person to now being able to deliver programs virtually. So no, we are hoping to get back into in-person programs, because we know that the most effective way to teach people about healthy eating is to have them taste their way to healthy eating. But we will always have virtual programs. So we will be doing both.
That's great. So, so how do I take part in a program or different programs that I'm interested in?
So right now we are planning our fall programming, and if you would like to sign up for our email, just go to eatingforyourhealth.org and you can sign up, and you will be notified of all of our programs as they come out. We're also aligning with different community partners. We know that we can reach so many people ourselves, but we want to reach many, many more people. And to do that, we're aligning with as many community partners as we can to be their health and nutrition programs for them. So we've delivered a program for the Princeton Public Library. We're doing the Dorothy Mullen Speaker Series for the Princeton Public School System. We are going to be delivering a 6-part series of programs for the Breast Cancer Resource Center. We're looking at programs in Trenton. We've delivered a program for Mill Hill Child and Family Development and Dress for Success of Central Jersey. And Homeworks Trenton, we're going to be delivering a program for them. Westminster Presbyterian Church, Lawrenceville Presbyterian Church. I want to be everywhere. I want everybody to learn about this. Every single person who eats and is curious about eating in a healthier way. They don't have to be totally committed. Curious about eating in a healthier way. That's who we want to reach. So if you are listening and you have an organization who you think could benefit from these programs, reach out to us. That's my goal.
That's great. And obviously this is not some fad diet program. So this is, you guys are doing real stuff here.
We don't even talk about diets.
Yep.
We talk very little about calories. And what we found is that when people adopt this way of eating and they look to eliminate those processed foods that really aren't feeding you, the weight just kind of manages itself. Diet, different styles of eating is what we talk about, like the Mediterranean diet, or some people want to do the paleo diet or things like that. And that's fine. That's fine. You figure out what works for you. But we just focus on whole food ingredients, looking at the sugars, those added sugars, those hidden sugars that are in so many foods. I meant to pick up a packet of salt from an area convenience store. You look at the list of ingredients in a packet of salt, it says sodium and dextrose. There's no reason to have sugar in your salt. Salt is a preservative. There's no reason. It's crazy. It's crazy.
The things people will learn by taking part in your program.
They will. The other thing is you can't unlearn that 4 grams of sugar is a teaspoon. And there are 39 grams of sugar in a can of Coke. There's often 16 grams of sugar in a little thing of yogurt. So people don't intend to do that.
Yeah.
There's a lot of sugar in juices. Don't drink your calories.
Yeah.
Eat that fruit. You get the fiber.
Yeah. Okay. So it's amazing already all you've helped us with. But so you must have other knowledgeable people helping you, who help you create the different programs. So I know you mentioned one of the doctors you have, but I think you have a whole slew of people.
We do. Well, Dorothy Mullen is, she is the founder of the concepts of everything that we're doing. Everything that we're doing is built on the 7 pillars of eating for your health. Fiona Capstick is a registered nurse. She's also a diabetes educator and health coach. And she has been our board chair, and she and I work together along with Dr. Benito to really put together our curriculum and figure out what we need to talk about. We have many other practitioners who come and deliver programs. Julie Pantelick has delivered programs for us. Dr. Ailey Cohen has delivered programs. I'm always looking for people who want to come in and talk about whatever they're passionate about. So if you want to talk about something and it's related to healthy eating, that's what we're looking to do, and just amplify those messages.
Yeah. Yeah. Well, I think that's a really great goal, because right now it's so hard to know what it is that you're actually eating, right?
Yeah.
It doesn't matter whatever the thing you're eating is called. It's like, okay, I better really look at those ingredients.
Look at the ingredients.
Who knows what's really in there?
Look them up. Sometimes if you look them up, it's a little scary, but knowledge is power, right? So be curious.
Be curious. That's a good one. So how do you reach out to people for your programs? I know you mentioned that, they could go to your website.
Yeah,
but...
So, we're on Facebook. We don't have that much of a following on Twitter. That's okay. We are on Instagram, and we try and just get as much content as we can published. I'm talking to people like you, doing podcasts where I can, and again, aligning with other community partners and helping them to share information, which then could lead people to our programs. We have a blog, eatingforyourhealth.blog, and there's a ton of information there. So, it's sign up for our emails and newsletters, and we're working on just getting the message out there.
Got it. Well, so you partner with a number of farmers. Are they? Where do they come from? Where are these places?
So, understanding where your food comes from is something that humans in many parts of the world, but definitely here, have been removed from. So, aligning with those farmers who have those regenerative farming practices. They don't have to be organic, purely organic, but really, farming in a healthier way, buying produce that hasn't been on a truck for days. They value the importance of whole food ingredients. We value the importance of whole food ingredients. It just makes sense to align with them and support them however we can, which means shop from them.
Right. Okay. And that's all, obviously, the more people become involved and read your blog or get your newsletter, et cetera.
Yeah, we have amazing farmers markets around here. Yeah. I mean, the Princeton one, the West Windsor one, the Trenton Farmers Market. It's really incredible, and it's growing season now. And even just growing your own, getting a little pot of lettuce going, or herbs that the deer don't eat. Deer don't eat herbs.
There you go. So one of the programs that I was reading up a little bit on was the At the Table program.
Yes.
So how do these happen? How do you get involved in that one?
So that's these were programs that were held in people's homes, and we are looking for public spaces to hold them. And they are really supportive, informative gatherings where people, we meet, we cook, we eat, we learn. So that's an opportunity for people to learn how to cook who don't know how to cook. We've had people who, somebody who doesn't really know what to do with an onion next to somebody who's a chef and feeds 800 kids a day. And they both learn from each other. So it's supportive. We're right now coming out of the pandemic. I'm looking for venues to hold these meetings. The people's homes thing can be a little bit of a challenge right now, but we're working on that, and that we'll be sending out information about that soon. The goal is that once we start delivering programs and people want to learn more and they want to learn how to cook, that we're hoping that organizations who host other meetings will also host these meetings. And that's the support that we provide, because eating is social.
Right.
And it's emotional. People have emotional ties to their foods. They have emotional ties to their celebratory foods. And when you start to mess with them, whole families can get really upset. And it can be lonely. It can be really lonely when somebody's been diagnosed with prediabetes or diabetes or, name the ailment. And one of the things that they're told is that they need to eat in a healthier way. And the rest of their family is still eating the way they've been eating. It's hard. So that's what we do is help people through that journey, which can be lonely, and understand that we're like-minded people who are along with them, not judging when they do eat that whole row of Oreos.
Right, sure.
It's like it happens. But it's and then helping to bring people along with them, which even some people that I know in my family who were very meat and potato-y are very open now to a lot of leafy greens. So.
Funny how things can change. So, but as you look for these venues to hold this type of event, like how much, how many people are you hoping to host at a thing? How elaborate a kitchen do you need?
We don't need an elaborate kitchen. I mean, that's one of the things that I realized when at one point we were looking for some space, and I said, we need a kitchen that replicates what people are dealing with in their homes. Mm-hmm. So we don't need a lot of space. We do need, it would be nice if we had a stove and an oven and a sink, but we can do amazing things with a sink and a crock pot.
Right.
So, or an Instant Pot. So we don't need elaborate spaces, but we definitely need a sink, and we definitely need a meeting area. So, but kitchens, teaching kitchens are wonderful. Church kitchens are wonderful. Community kitchens are wonderful.
Right.
So.
All right, well, it's good to know. I just wanted to get that detail out there, because you never know who's listening. And
I never know.
Says, oh.
Yeah. We are looking for an interim space, or we don't really know what we need yet. So that's why it's not something that we're prepared to invest in. We're really looking to move the mission forward of the education piece, and not necessarily spend money on a location when we know we need to bring our program to the community.
Okay. I know you have numerous workshops. So again, I keep asking, how do I get involved in all this stuff? No, I'm not going to show up at all of these, but maybe I'll show up at a couple. But anyway, how does someone get involved in those?
So again, it's, we have listed on our calendar on our website all of our programs. Right now we are light in August, but we've got quite a list of programs that we're going to be designing and delivering in the fall. So check it out. Look, like I said, we're looking for different locations. I consider, Bucks County, Pennsylvania is kind of part of New Jersey. So we, I'll travel to do this. I mean, not tremendously. That doesn't make sense. But
right.
Any place that people want to host a program, they can. There's also people who are hosting fundraising programs for us, where we'll come in. They invite people into their homes. We'll come in and we can either cook something or do some sort of a cooking demo, and doing fundraisers that way. So. We're just looking to build the programs back up after having these 2.5 years.
Got it. Okay, so everybody should be checking out the newsletters.
Check out the newsletters and the website and
start
the
planning
calendar.
Their fall.
Yeah,
their
absolutely.
Fall education.
Absolutely.
Eat the right stuff.
Yeah, we're actually doing a program for the Plainsboro Senior Center in November, carving the carbs out of Thanksgiving.
Oh, wow.
So that'll be interesting. Yeah. So it's a challenge.
Well, people are used to eating a certain way or not paying a lot of attention to what it is they're actually eating.
And then they get sick. And then, diabetes, type 2 diabetes is epidemic.
Yeah.
I mean, probably more people have it than know they have it. And, eliminating and reducing those processed foods is a big way to either reduce the impact or prevent it from happening.
Yeah. So I know ability to pay is considered in your program so that virtually anybody could participate. How does that work, and how do other people help support that effort so you're able to do that?
So that's where the community partners come in, and grant funding. I mean, we were looking at fee-based programs, and we realized that it's something that we really need to have grants and sponsors to be able to deliver the program, so that cost isn't prohibitive.
Okay, so is there a way through your website or whatever if people want to help?
Yeah, and we're building a new website so that we can have a scale as far as what people can pay. Right now, we don't have the ability to do that.
Right.
So Technology is something that we are, supports our efforts tremendously. We have some limitations now, which is why it's not that easy to do, but we're working on that.
Yeah. All right. So I know we mentioned your website a little earlier, but I like to make sure we mention it multiple times. So I'm going to ask you again, what is your website? And so I think we've already talked about, my question I already had prepared was, how do I keep track of what you do? But
sign up.
Anyway, we've covered that one quite a bit.
So we chose the brand Eating for Your Health, Eating for Your Health, because hopefully people will remember that. Right. So eatingforyourhealth.org is our website, eatingforyourhealth.org, not, just spelled out, and eatingforyourhealth.blog is our blog.
Good. Thank you.
Thank you.
So Marion, let me ask you totally different from everything I've asked you so far. Are you from here, around here? Or?
I've lived in Montgomery Township for 26 years. So Princeton, we were right across the border. Princeton was our stomping ground when my kids were young, and they'd eat their way through Princeton. So yeah, it's but then I grew up in Edison, so I came all the way from still in Central Jersey.
Yeah.
Which is a thing.
Yeah, not that far away at all. Not that far away at all. And then, so how did you come to be in this position? So
it was kind of a bit serendipitous, where I just was having lunch with a friend, and she said, we were talking about this great salad that we were having and healthy food, how wonderful it is. And she asked me if I knew about suppers and if I knew DAR, and I said no. And she's like, you have to know DAR and you have to know suppers. So I went to a meeting. I was like, all right, this is kind of cool. All right, all right, it's okay. And then I did a kraut making workshop with Dorothy, and then I took her gardening program, which was 6 months, 7 sessions in her garden. And I just really felt the need to get back into the soil. I had always gardened when I was young, but with my own kids, I didn't take any time to do it. So took this program, fell in love with the program, fell in love with Dorothy's way of teaching, and started to help her with the organization. My background is in marketing and business consulting, so I asked if I could help her just kind of structure the organization. So we started working together in, I believe it was like 2018, I was trying to gather all the information from her, because everything was in her head. She was delivering 90% of the programs, what it took to run all of the programs. And when she would say, well, it's about 3 hours. And I'm like, all right, well, for a regular human, that's 6 hours. So we worked together for about 18 months, gathering all the information so that we could build a strategic plan based on real information about what it took to run the organization. So then she asked me if I wanted to be on the board, and I said, no, thank you, because I like to date boards before I join them to see if it's, something I wanted to do. So I got to know the board, and then I did join the board in March of 2019. The end of April, Dorothy was diagnosed with stage 4 lung cancer, stopped delivering all of her programs by the end of June, and I was just concerned about the future of the organization. So was Fiona, and I was also in a space where I had been working for Rita McGrath, who's a Columbia Business School professor, for 5 years. I just made the decision to go back into my own consulting practice that February. And Rita's focus is innovation and growth strategies during times of uncertainty. So I felt like everything that I had done for the last 5 years with her, everything that I had done in my own practice of consulting with small businesses kind of prepared me for this role. Like, I knew how to set up a website and how to get a URL and do all these other things. And so I said, I didn't have this big group of clients that I had to say, I'm not doing this yet, because I was just building my practice back up. So I proposed that I would lead the organization on a half-time basis and to see if we can move it forward. So we did. That was August of 2019, and then the pandemic hit in March. So, but since then we have really reimagined the organization in a way that we're really, really proud of, and I'm now doing this full time.
That's great. Wow.
Yeah. I know. Who knew?
Sometimes things line up.
I know.
Yeah. So let's just say, as you look ahead, what do you see unfolding for Eating for Your Health over the next, let's say, 3 to 5 years?
So this year is the year that we're building audiences. Next year, we want to integrate healthcare systems and be able to deliver our programs to when people coming out of the hospital or out of the doctor's office told they need to eat in a healthier way, and they don't know what to do. We want to be that referral source. So that's the next year's plan, and then. And all while we're doing this is really to create awareness for practitioners of all sorts of healthcare practitioners to know that we're here and to send people to us. So that's in the plan. That's like our strategic plan. And then another part of that is to train the trainer. So to have more people that can deliver our programs, and you don't need to be a healthcare practitioner. We script a lot of our programs. And what's most important is not to interject what you think people should be doing. We're not prescriptive. We will never tell you what to eat and what not to eat, with the exception of whole food ingredients that work with your system, with your own biological individuality. So to build that workforce of people who, it's really peer-led programming that we do, and then finding those subject matter experts that can do the deeper dives. But really just to deliver programs wherever we'll see where this takes us, aligning with other organizations and just, meet people where they are and, just growing that knowledge base and growing the audience and growing the number of people who can deliver the programs.
Yeah. Well,
so we're looking for volunteers right now to start. And volunteers, venues, audiences, those curious eaters.
Curious eaters.
And what's great about us is that people can't say like, no, that eating thing, I don't really do that anymore. It's like.
But this is something that would really work well for everybody, for anybody.
It really it's amazing when we talk about the nutrients that are in foods. Like I'm just crazy about parsley these days. Like parsley has vitamin K, which is really important for your bone health, for blood clotting. It helps with your kidneys. If you tend to have kidney stones, parsley is really good for that. And you can add it to almost everything.
Right.
They're all there. Yeah, I can go.
We can go on for hours.
I could,
but we won't. So I just want to encourage people that are listening, right? So as you said, you're looking for kitchen space.
Yes.
You're looking for volunteers. People should find ways to support the organization so you can provide your services to people that might not be able to otherwise afford it or take part.
And our recipes, check out our recipes. We have hundreds, I believe over 800 recipes. They are all gluten-free. They're all dairy-free, or dairy. There's no you don't need to add dairy to make it work. And they're delicious. There's no processed foods at all.
Which is a good thing. Things we need to get away from. So, all right. So we need to remind people, eatingforyourhealth.org. Get there, sign up for the newsletter, find out all the different things that you guys are offering.
Yeah. And share with us what's worked for you, because we like to learn from you as much as you learn from us. And we're always looking for healthy versions of celebratory foods, healthy versions of cultural foods, because it has to be delicious or else it just doesn't work.
Wow. Marion, thank you so much. This has been great. I really appreciate you being here today.
Thank you so much and for giving me the opportunity to share.
Great.
Thank you for joining us for the 22nd episode of the Princeton Podcast, produced as a community service by HG Media, providing audio, video, and website design services here in Princeton since 1999. For more information on this episode, please visit our website, princetonpodcast.com. And if you enjoyed this episode, please share it with your friends and be sure to subscribe to us on Apple Podcasts, Spotify, Google, Stitcher, or wherever you listen to podcasts.